Well, good afternoon, everyone. Today is our briefing for April the 20th. It's a Monday, and we have several updates to share with everyone today. Want to obviously just begin by thanking everyone over the weekend. We had obviously another weekend. We had generally very good response from individuals that were out, and I know that our police department and fire department. I want to thank the community for being compliant when asked to follow our safer at home order, and we think for the most part, most folks are following the orders. There still are some that need to, and we're going to talk about that a little bit today. The latest numbers for Long Beach is we have a total positivity rate of 464 cases. That's 464 residents who have tested positive for COVID-19. The good news out of that number is approximately 266 of them have actually recovered. And so we about 266 of the 464 have recovered that have tested positive for COVID-19. Unfortunately, of course, we continue to have more individuals that pass away. We had an additional 4 residents in the last couple of days lose their lives to COVID-19. That brings our total to 24. And all this information is now available at our dashboard that we have at the COVID-19 website that has all of the information, those that passed away, the positive cases, and how we're doing as it relates to hospitalizations as well. I do want to, again, remind folks that every single one of those lives is really critical. Our prayers, our hearts go out to the families, to the medical personnel, and the way to help people and continue to save lives is to follow our health orders and to have folks please stay home as we continue to have serious issues as it relates to making sure that we're prepared and that the country's prepared for the weeks and months ahead. Let me begin by giving some overall information. Overall, the good news coming out of the end of last week, which I shared, was that we more than tripled our testing capacity. And so we now have in Long Beach the capacity to do over 500 tests every single day. That's been a huge priority for us. We heard early on that there would be tests from the federal government for everyone in the country that wanted one. That never materialized in the way that we would have liked. And so, of course, we went out ourselves and purchased our own tests through the city. Those tests are now being done at multiple sites. And as a reminder, folks can get a drive-through test today at one of 4 locations in Long Beach. They can go to Jordan High School in North Long Beach. They can go to Cabrillo High School in West Long Beach. They can go to St. Mary Hospital, which now has a center right adjacent, not too far from downtown. And they can go to the Long Beach City College Pacific Coast campus site, which is, of course, in the center part of the city. All 4 of those locations have drive-through testing available right now. And I will tell you what we're seeing is different folks know different centers. We have capacity to take more tests. And so this weekend, we just launched the testing. The Long Beach City College site fills up rather quickly, and that is seeing really good traffic of testing. The Jordan site did a fair number of tests over the weekend, but we still have a lot of capacity at the Cabrillo High School site in West Long Beach. And I also understand that St. Mary today had a fair number of appointments, over 150 appointments that last I checked were set for St. Mary Hospital today. And so again, we have appointments available. You can go to the COVID-19 website at longbeach.gov. If you go to right on the homepage at longbeach.gov, you can push the COVID-19 website and there's a testing link right there. But if you don't have access to the internet, or if you maybe aren't comfortable with using a computer, you can also just call our COVID-19 hotline, which is 562-570-INFO or 570-4636. If you call that number, we will get you set up with a testing appointment. If you have symptoms, if you go online and you want to just directly push one of the 4 drive-through testing little links, you can sign up for an appointment and we'll make sure you get a test. So again, we want people to get tested. Please use the testing centers. In addition to that, Long Beach City College, we have the Rapid Assessment Clinic. And again, all of these assessments, these tests are free of charge, whether you have insurance or whether you don't have insurance. So please get tested and get the medical care that you need. I want to add that this weekend we announced a shift in some of the work that's happening in the fire department. We have now created, through the work of our fire department, a new mobile assessment team. And these teams within the fire department are specific to the COVID-19 health crisis. So these mobile assessment teams essentially now transport individuals that may have COVID-19 or that have been confirmed to have the virus if they need or have a medical emergency and need to get to a hospital. It's a way to have a specialized, trained fire units, and in a way that limits exposure of folks and patients that may have COVID-19 with others. So it protects our paramedics, our firefighters, the public, and of course our hospitals and health department as well. These rapid assessment teams have special safety equipment. They've undergone special procedures and training and are out there every day trying to get people the care that they need. So I want to thank again the fire department. And if you are, of course, showing symptoms or need care, we always want folks to make sure they dial 911, they get to someone that they can talk to if they really need medical care, a paramedic or some type of hospitalization. And we'll make that assessment of which unit comes out to see folks. So again, thank you to the Long Beach Fire Department on that. I want to also just note there's been a lot of discussion and Dr. Davis has been answering questions as well about the antibody test. We have received a lot of questions about when will antibody testing be available? Is antibody testing available at our clinic or through our drive-thrus? So I just want to just clarify so that folks are aware. There is antibody testing happening across the country, but most of that testing right now is in the research phase. And so there are universities and health agencies that are doing antibody testing, but a lot of it is still being researched. That research is then being peer reviewed with other research so that when the country and Long Beach and the rest of us are ready to really do the larger mass antibody testing, it will be done in a way that is safe and most importantly, accurate. I say this because just a few hours ago, the LA County and USC, the University of Southern California, released a very early results from their antibody test and their antibody study. And as a note of caution, because USC and the county both have noted this is early information from a study that still needs to go through an extensive process of peer review across the country to ensure that the results are correct. But we are, of course, following and partnering with LA County Health. We are following the USC research project. And as soon as the City of Long Beach, the County of Los Angeles, the City of Los Angeles, California, that as soon as there is a standard that is set for health departments, for cities, and as soon as we have the information and the validity that we know the tests are accurate, just know for everyone that's asking, we will be prepared to go into that phase, but we want to make sure that we're all doing it together and that the science is right. And so just please know that's something that we know is being worked on. And I think Dr. Davis addressed that also last week as well. But we are right now digging into this USC and LA County study as well. And let me also just note that tomorrow that we will be putting out the list of our new Economic Recovery Advisory Board members. I mentioned last week that Mayor Bob Foster would be leading an advisory group. He's of course, our former mayor, to help us reopen the economy in the weeks ahead that we have. And so we're putting together an advisory group that has been made up of business leaders, small business owners, workers, individuals from different industries, the arts, other types of businesses that are closed. And that group will work with the Long Beach Health Department and our health experts to provide recommendations on how and when the economy should reopen in a way that first and foremost is safe to the public and is based off of the best medical advice and experts that we have internally and also across the state and country. Also note that later this week on Wednesday, Governor Gavin Newsom will be putting out more information as to the state guidelines and the state process and framework as to when and how some of our economy will begin to reopen. And what we're trying to do in Long Beach is we want to come up with the absolute best ideas from our community, from our small business owners, from local residents, and about what is the smartest way, the most innovative way, the safest way, so that when we're ready to begin opening up some of these restaurants or barbershops or parks or places that I know folks really want to go to, that we have the best ideas and that we're sharing those ideas with all of our neighboring cities in California and with the governor and his team as well. And so we'll have a lot of information on the advisory board tomorrow, including a full list of who's going to be on that board. And I want to again thank Mayor Bob Foster for his work and for leading that effort for the city of Long Beach. With that, I want to turn this over to Dr. Davis, who's going to give us more of an update on some health-related information, and then we're going to open it up for questions from the media, and then we'll do a Spanish translation as well in just a few minutes.
Thank you, Mayor. Good afternoon. In public health, we study and learn from the past to help inform our efforts today. Just over 100 years ago, the 1918 influenza pandemic infected about a third of the world's population at the time and killed more than 50 million people, including 150 in Long Beach. As tragic as this was, we learned about the risks of relaxing our efforts too early. When officials ended preventive measures and opened schools, churches, and businesses back up, the virus returned with a vengeance. The second and third waves of the flu were far more deadly than the first. We now have the benefit of these lessons, plus modern medicine, data science, incredible technology, and public health planning to inform our response today. We will use all of these tools to guide us. We know that this is a hard time for families who are out of work and for children who are out of school and childcare. This won't last forever, but if we relax restrictions too soon, it could undo all of the progress we've made up until now. A key part of our efforts in getting back to normal is widespread testing and developing new treatment options. As Mayor Garcia mentioned earlier, we want to make it as easy as possible for everyone to make an appointment, get tested, and have their questions answered. Our new testing centers at Jordan High School and Cabrillo make it even easier for people in West Long Beach and North Long Beach to get tested. We're also closely tracking new developments in treatment for COVID-19, including the use of convalescent plasma. People who have fully recovered from COVID-19 have antibodies in their blood plasma that can attack the virus. This is called convalescent plasma and is being evaluated as treatment for patients with serious or immediately life-threatening COVID-19 infections, or for those who are at high risk to develop those infections or severe disease. Additionally, learning more about the use of convalescent plasma now will help us be better prepared if a second wave of disease occurs, as has happened with past viral outbreaks. If you or someone you know has tested positive and recovered from COVID-19, you can learn more about convalescent plasma, including who is eligible and how to donate by visiting the Red Cross's website at redcrossblood.org. Finally, for all the latest information and updates, please continue to check our website, www.longbeach.gov/COVID-19. You can also follow us at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you. We're going to go ahead and open it up for questions. I know they've got a good amount of questions today, so I'll turn it over to Jake for the first questions.
Mayor, the first question is going to come from Rachel Jordan from ABC7.
Okay.
Rachel?
Hey, so this question is for Dr. Anissa Davis. So now that the city has tripled its testing capacity over the past couple of days, should we be expecting a spike in numbers of positive cases over the next few days?
I'm sorry, a what in number?
Spike.
A
spike.
spike in numbers?
So as more people get tested, we would expect there to be a higher number of positives, just by the fact that now we're reaching out to, say, like the mayor mentioned, 500 people per day, as opposed to much less than that in the past. So probably as the days go forward, like later on this week, beginning of next week, we probably will start to see more positive cases. So that's expected.
All right, the next question is from Kelly from the Long Beach Post. Go ahead, Kelly.
Yes, hi there. There's been some concern about the city reporting coronavirus cases by zip code, considering the huge variation in density in different zip codes. Is the city looking at maybe different ways to calibrate this to give a more accurate depiction of how coronavirus has affected different zip codes compared to density?
Yeah, that's a good question. So I've actually talked to a few folks in the last day or two about that very question. I mean, the zip code reporting is accurate, right? So it's certainly the data that's on there is accurate per zip code. So that's certainly the case. And you'll see that zip code and reporting by zip code is not an uncommon way to report this data. So that's a well-known, well-used standard that's being used. However, I think there are good observations and some good critiques being made that one zip code might be more dense or have more folks in a zip code than another. So can we also maybe create different modeling on the dashboard so that those types of factors can be included? So I agree with those. And I know that I had a conversation with some of our team over the weekend, and so they are working on that, because I think that's a really important question. We want to make sure that if folks need to look at that data and do a layover with density or how dense that zip code might be comparative to another one, that's important. So I think that's a good question, and that should be updated and or added features to get to that, I think, in the next couple of days.
All right, Mayor, the next question is from Daisha from Random Lengths News.
Hello. My question is, with the president and others in the U.S. Senate pushing to reopen the economy as soon as possible, how is the city of Long Beach handling this matter, and what information can you give residents who are concerned, confused, or timid on the subject?
Sure. I think first the important thing is that in Long Beach, we are going to, when we reopen our economy and go in that direction, it will be done on the complete advice and really a process that's inclusive of our medical advice and the science. That's at the end of the day the most important thing. I know there's a lot of rush to open this and get something open as quick as possible. And the truth is that right now in California, and as it relates to our stay-at-home orders, to me, the science and data is very clear. People need to continue to stay at home. Cases continue to rise. Hospitalizations continue to increase. We continue to have folks out there that have not yet either had been tested or that are not symptomatic and that are spreading the virus. So our approach in Long Beach, I think, is in line with the governor's approach and the approach we're taking across the county, which is the single most important factor is the health of the public, and to ensure that our most vulnerable community, our seniors, folks with underlying medical conditions, are not put in a situation where they're hospitalized and could die in some cases. And so we are following the science and the data, and knowing, of course, that people need to get back to work and people need to survive and have, in many cases, have an income, and businesses, small businesses, are suffering. So we understand all of that, which is why, while we are guided by science and data, we are coming up with the best ideas on how we reopen the economy using good science and data, so that when we're ready and when the governor's framework is in place for us to reopen California, we do so in a way that is smart. But, we are in no way going to be pushed to reopen anything because of political pressure or because, the group of folks holding signs on a corner. That is not going to influence the science, the data, and the medical advice that we're getting from our health department, the County of Los Angeles Health Department, and the state.
All right, Mary, it looks like we have one more question from the media here. This is from Jeremiah from the Long Beach Post. Go ahead, Jeremiah.
Hi, guys. Thanks for taking our questions again. And I'm kind of trying to drill down a little bit more specifically on something that you've talked about to that last question. But it's kind of two parts for Mayor Garcia and then the second part for Dr. Davis. You've obviously seen the protests in some areas across the country. There's been some talk of a small group organizing one here. My question is, if that happens, how would the city respond to that? Would there be a stepped-up enforcement? Would it be allowed to proceed? And Dr. Davis, one of the specific things people have brought up when they're talking about reopening the economy is some people have wondered, why is it that it's safe to go to a grocery store with social distancing and measures, but it's not safe to, say, go to a non-essential small business? Why is a grocery store allowed to stay open with these precautions, but a non-essential small business wouldn't be allowed to stay open with those precautions?
So I'll maybe take the first part. So we are aware that there has been some online discussion and chatter about a possible demonstration in Long Beach. Just to be clear, there are health orders and guidelines right now about not gathering in parks and public spaces, about folks having face coverings when they're next to other people. And so while I think all of us agree with everyone's First Amendment rights, we also will enforce and follow our health orders that we have put out in the city of Long Beach. And so what I would say is that individuals, anyone out there, we all have a right to give our opinions and to make how we feel known. But I would ask that every single person should be considering and think about the people and the workers in our hospitals, our nurses, our paramedics, our firefighters, our doctors, and the patients who are pleading with us to do the right thing and to stay at home and to not cause further spread of COVID-19. The sooner that we all follow the safer at home orders, the sooner that we can all get back to and begin going back to the process of having a more normal economy that we all want to be at. And so groups of folks, and I saw what happened, of course, in Huntington Beach, that is not productive. That is not helpful. It is dangerous, in my opinion, when individuals were gathered in groups that way. And so I think that a vast majority of folks get it. I think that a vast majority of people in Long Beach understand the seriousness of the issue. And I would ask people to be compassionate and think of others, and not take actions that, quite frankly, in my opinion, are short-sighted and dangerous. And so I think that we'll see what happens in the weeks ahead, but the city is very aware of some of the discussions going on online.
And then to address the second part of your question, which was about why are essential businesses allowed to do masking and social distancing or physical distancing, but not non-essential businesses. So the goal of the stay-at-home order was to reduce the number of people who were out and about in order to reduce transmission of the virus. Because the virus spreads very efficiently from person to person, and so if you have fewer people around that the virus can jump to, then you're going to have less transmission. There's going to be less people of vulnerable populations becoming infected, less stress on the healthcare system. So that was the goal. So the goal was to have everybody at home. However, there are certain essential businesses that have to be able to operate in order for the rest of society not to have even worse outcomes. So you have to be able to have food, you have to have your lights on, things like that. So those were essential businesses that we felt like we had to let continue to operate. Now, within that, we still needed to make sure that we did everything that we could to guarantee worker safety. So we're saying that you're an essential business, we really need you to operate. However, what do we do to have the safest workplace that we can? And so that's where the physical distancing and the facial cloth coverings and all of the other social distancing, having good hand washing, putting down plexiglass barriers, kind of all of those things were to make sure that we had the best workplace safety that we could, because you're an essential business and we needed you to operate in order for us not to have worse societal outcomes.
Thank you, Dr. Davis. We're going to go to social media now. We have some questions that we've had on Facebook, and I'd like to just open this up for the comments either from the mayor or Dr. Davis, but specifically about the hospitals. And this question is the VA hospital involved with the efforts in any way? And then a secondary question to that is what happened to community hospitals opening?
So good question. So I think the VA is involved, of course, in our efforts. They have obviously a very unique mission to serve our veterans and those that have served our country, but they are part of the larger conversations happening within the medical community and, of course, our hospital group. But they are, of course, focused on the work that they're doing, and so. We are, of course, in communication. And again, when it relates to community. It's a state licensing issue as it relates to that the hospital needs to get licensed from the state. And I know that the hospital is in constant communication with the state on when that'll open. But they have hired staff. They have their materials and supplies ready. And we're all anxious, including myself, to get community hospital open as soon as possible. Wanted to add one thing, Jake. There was a note here, maybe this was from the press telegram, if we could give the numbers of the tests at the different locations. So why don't I just read that really quick. So over the weekend, what we have so far is we saw, this will give you some approximate numbers, we saw about 176 individuals at the Long Beach City College site. That was over the weekend. Jordan, there was about 156 that were seen. At the Cabrillo site. It was about 40. And so the Cabrillo site still has a lot of capacity. They all have some capacity to increase. From what I understand, today, the St. Mary location had about 150 appointments set up, but we won't know the number till later in the day. And so that's all approximate. Did I get that right, Jake? I want to make sure I have those numbers correct. And so I know that was one of the questions. So there is capacity, and we want folks to sign up for testing. Absolutely, Mayor. Yes, that was a question from Donna from the Daily Breeze and the SCNG group. And in addition, I would state that we also, as of today, have the 95 scheduled appointments at Cabrillo and Jordan, but there's still room for more, just like you stated earlier. And we really do want to encourage people to go and sign up for those appointments. That's really important. Absolutely. Dr. Davis, following up on the appointments, there's a lot of question about why do I need an appointment? Why can I just show up and get tested? And do I need to be sick to get tested? There are questions on Facebook asking those questions about the process for testing. And can you get into that a little bit for us? So it is important, I think, in order to have the correct staffing and the correct flow, that we kind of know what the day is going to look like. So I do think it's important to use the sign up website. That also pre-populates a lot of the information that we need in order to run the test. So that's another way that it's streamlined. We do recommend that only people right now who have symptoms be tested. There is still a shortage of testing supplies throughout the supply chain, all the way from the swabs to the actual thing that you put the swabs in to the actual kit. So it is important that you have symptoms in order to be tested. And that also helps the test be as accurate as it can be if we're doing it when you actually have symptoms. Thank you, Dr. Davis. Well, Mayor, we're going to take one more question from social media, and this is also related to homelessness. And you've certainly done a lot of work with regard to persons experiencing homelessness. But the question here from Facebook is, are the homeless that we see on the street refusing tests and services? Can you elaborate on that, please? So, I haven't checked the dashboard in the last day or so, but I want to say about 60% of our shelters that we've opened that's about the number of the capacity right now. So we have room. Our shelters and the rooms that we have availability for people experiencing homelessness. But again, you can't force a person experiencing homelessness to seek shelter. We would like all folks that don't have shelter to use our shelters. We have the bed capacity, but we also are ensuring that these shelters have food available. There is medical services, there's showers, so there is an opportunity for folks to get the care that they need. As it relates to testing and to medical care, I think we mentioned last week we had our first person that was homeless that tested positive for COVID. We are obviously offering that test is available to anyone, and if there's a sign or an outreach worker or one of our nonprofits that works with that community thinks someone has COVID-19, of course, we'll try to get them tested. But we also have to be careful about everyone has rights, including people experiencing homelessness, of course. And so what we can force or not force someone to do is a fine line. I'm not sure, Dr. Davis, if there's anything you want to add to that, but.
I think we're working really diligently to outreach. In general, it's a lot of relationship building in order to form relationships with that community and to instill trust. And so that'll be ongoing. And I think our occupancy will increase as we continue to do that.
Absolutely. And we have all of our service providers that are working with this population. They know about our shelters. We're letting folks know. And so we want folks to use them as well. And so we've done that. We have special kits that our outreach workers now have. And we have placed washing stations and soap and water stations all across the city, additional stations for people experiencing homelessness so that they can also try to stay as healthy as possible. So those are all things that we're trying to do.
Mayor, before we wrap up here, I know this morning you were over at Lola's and talking about the feeding services that are happening. Would you just go into some of the senior services and some of the feeding services that we're doing through the great outreach with the Community Foundation and the grants? I think the viewers would like to hear about that.
Sure. Earlier today, I visited Lola's, which is one of a great restaurant, of course, in Long Beach, the Bixby Knolls location. I was there. They're a part of a program with World Central Kitchen, which we've discussed before. They are making 1,100 senior meals prepackaged a day, 6 days a week, to numerous senior buildings across the city of Long Beach. I know them, the Ordinaire in downtown, other partners are all creating these meals for them. It's at no cost for the seniors, and they're being delivered by UPS at no cost. So that's a great program. We have a special line phone number just for seniors as well. We have special senior programs for seniors. We encourage folks that if you are a senior and older adult, there's a lot of help out there. Jake, did you want to read the line, the senior line? Do you have that?
Yeah, it would actually be the 570 info line, and they can actually route based on the quote, the number that is inquiring specifically. They'll be able to touch and.
So if you just call 570 info, they'll take you right there to the information. Great.
Option 5.
Yeah, option 5 for the
option
senior.
5. Option 5. 570 info. Option 5. Absolutely great.
All right, that's it for the questions here. Thank you very much for everyone for their comments and feedback, and our media partners there. Mayor.
Thank you. I want to thank, of course, Paola, who's doing our translation to ASL, who's right behind me. And now I want to give this over to Alice Castellanos from the Health Department, who's going to do a summary for us in Spanish.
Hola, muy buenas tardes y gracias por estar con nosotros hoy. Desde hoy tenemos 464 residentes que han probado positivo del coronavirus y 266 se han recuperado. Desde el viernes, desde nuestro nuestra última sesión informativa hemos perdido a 4 residentes adicionales, que ahora nuestro número total es de 24 muertes del coronavirus. Hemos visto algunas protestas de orden de salud. Estos números muestran lo importante que es para todos nosotros seguir la orden de salud más seguro en el hogar y el orden del Estado practicando el distanciamiento físico. Como se muestra en las protestas en todo el país, entendemos que quedarse en casa es difícil, pero queremos agradecerle a todos por cumplir con estas importantes órdenes de permanecerse en casa y solo salir cuando es absolutamente necesario. Se abrieron 3 nuevos sitios de prueba del coronavirus durante el fin de semana, lo que se permite evaluar más de 500 personas al día. Estos servicios y pruebas son completamente gratis, pero recuerden que también es con cita previa. Desde los sitios que están operando desde este fin de semana, el horario es de 10 de la mañana a 1 de la tarde. En los 7 días de la semana, algunos de los nuevos sitios para pruebas son en el lado norte de Long Beach, en Jordan High School, y también en el lado oeste de Long Beach, que es en Cabrillo High School. Un tercer sitio nuevo opera en el Centro Médico de St. Mary's. Queremos que sea lo más fácil posible poder obtener una prueba del coronavirus. Si necesita asistencia personal y si necesita asistencia en otro lenguaje, está disponible cuando llama a nuestra cita de la ciudad de Long Beach. También ellos le pueden ayudar para agarrar una cita en cualquiera de estos sitios. La clínica de evaluación rápida, queremos recordarle que todavía está abierta y sus servicios corren desde hoy, lunes 20 de abril, desde las 10 de la mañana hasta las 4 de la tarde. Y esa no se necesita cita previa, pero es solamente para otros servicios médicos que no es necesario emergencia. Los pacientes pueden recibir tratamiento gratuito, recetas para enfermedades comunes. También pueden obtener y renovar recetas de medicamentos, que lo que necesitan. Lo único que a veces le pedimos es que traigan tal vez su receta más reciente o la botella donde tiene su receta para poder rellenarla. Cualquier persona interesada en hacerse la prueba puede visitar la página de pruebas de COVID-19 de la ciudad. También estamos haciendo algunos cambios en la forma que está trabajando el Departamento de Bomberos para poder protegerse a ellos mismos y también proteger a los residentes de Long Beach. Este programa se llamará el equipo de evaluación móvil. El Departamento de Bomberos creó un equipo de evaluación móvil para ayudar y garantizar que contengamos la propagación del coronavirus lo mejor posible durante las llamadas de emergencia. El MAT consiste de 2 paramédicos, una ambulancia que responde desde ubicaciones centrales dentro de la ciudad para facilitar una respuesta rápida. El equipo también proporciona evaluaciones de pacientes, tratamientos y transporte a hospitales locales según sea necesario. El que llame al 911 o el 911 se le preguntará si muestra síntomas del coronavirus y los despachadores transmitirán la información al equipo de evaluación móvil, que usará equipo de protección personal mientras trata y transporta a los pacientes y residentes. Después de cada transporte, el equipo reemplazará al equipo de seguridad usando y someterá procedimientos de desinfección de todo lo que usan en su equipo. También el equipo de evaluación permanecerá vigente hasta nuevo aviso. Hemos tenido muchas preguntas sobre las pruebas de anticuerpos. Queremos decirles que en este momento están en sus primeras etapas, más que nada los estudios científicos. También, lo único que sabemos ahorita es que el condado de Los Ángeles está trabajando con la Universidad del Sur de California en estas primeras etapas, o solamente es más que nada estudios científicos en este momento. Entre más recibamos más información, inmediatamente nosotros les haremos saber en estos informes de prensa. También queremos nomás tocar un poquito sobre la salud pública. Nosotros estudiamos y aprendemos del pasado para ayudar a informar a nuestros esfuerzos que estamos tomando hoy con esta pandemia. Hace más de 100 años, cuando la pandemia de gripe, primero en el año 1918, infectó aproximadamente un tercio de la población mundial en ese momento y mató más de 50 millones de personas, incluyendo 150 personas aquí en la ciudad de Long Beach. Desde entonces aprendimos sobre los riesgos de relajar esfuerzos demasiado pronto. Cuando oficiales pusieron fin a las medidas preventivas y abrieron escuelas, iglesias y empresas, el virus regresó con una venganza más tremenda. La segunda y tercera oleada de gripe fue mucho más mortal que la primera. Ahora tenemos el beneficio de estas lecciones, más medicina moderna, ciencia de datos, tecnología increíble y planificación de salud pública para informar a nuestra respuesta hoy. Usamos todas estas herramientas para guiarnos. Aún así, sabemos que en este momento tan difícil para las familias que no tienen trabajo y para los niños que no van a la escuela y el cuidado de los niños. Pero nuestra meta y nuestras metas siguen siendo la salud y la prevención de la propagación del coronavirus. Para nosotros es más importante mantener a la comunidad saludable que hacer decisiones muy rápidas y luego lamentarlas después. Por favor, recuerden que esto no va a durar para siempre. Las restricciones, si atenuamos las restricciones demasiado pronto, podría deshacer todo el progreso que hemos hecho hasta ahora. En una parte clave de nuestros esfuerzos para volver a la normalidad son las pruebas generalizadas y las opciones de tratamiento innovadoras. También estamos siguiendo de cerca las innovaciones en el tratamiento del coronavirus, incluyendo el uso de plasma de la gente que se ha recuperado. En entonces es la última información que tenemos para ustedes y gracias por acompañarnos hoy.
Y muchas gracias a todos que están mirando también. And thank you all for watching again today. And of course, we'll have our next briefing on Wednesday at the same time, 3 p.m. Thank you.